Hi everyone, I am Dr. Raghav Malik, consultant, cataract and refractive surgical sciences at Center for Sight. So yesterday I got a patient who asked me this very intriguing question that he said, Doctor, I have double vision. I see two of everything. Let's say if I'm standing or I'm sitting in a car and looking at a distant bus, I see two buses. So that in technical terms is known as diplopia, where you are seeing double images, where we can see two images of the same object, known as diplopia. Yes, there are certain ways where we can treat diplopia, but it is very important to know what is the exact cause of diplopia. So diplopia or double vision, like I said, has multiple causes. It can be something because of the muscles of the eye, wherein one eye, or let's say you have a squint where the eyes are not aligned, they are misaligned. One eye is more towards the right or towards the left. Because of that, there can be certain amount of weakness of the muscles wherein the patient is seeing double or there is diplopia. There are also other causes like a difference in power in one eye, like let's say one eye has a -7 and the other has -1. So that difference in power can also cause diplopia. So what is important is that we need to know that refractive surgery, if it can treat diplopia, then what kind of diplopia it can treat. So the kind of diplopia you have with a difference or a weakness of muscles, that cannot be treated by refractive surgery. That has to be dealt by a squint specialist. They will see what is the reason for the squint and they can possibly give you some treatment. Yes, there are certain types of treatments or certain types of lenses, glasses or contacts which you can use, which can treat your squint and which can in turn treat your diplopia. So in such cases, you can do refractive surgery and treat your diplopia also, but this has to be planned with a refractive surgeon and a squint specialist together. That is very important. Coming to simpler cases, where you have a difference in power. One eye, let's say, like I said, has a high cylindrical power. The other eye has a low cylindrical power. In such cases also, the patient will feel diplopia. Yes, such cases can be treated. How can we test? We give the patient a trial with a contact lens or a spectacle so that the patient knows how they are going to see after the procedure. If by the contact lenses this diplopia is disappearing, that means there's a high chance that the patient actually does very well after surgery and diplopia is treated. So it is very important to meet your ophthalmologist and discuss with them. Thirdly, the diplopia or double vision can also occur when you have a cataract. So when you have a cataract or Safed Motiabin, which we call in Hindi, so the patient actually feels doubling of vision. So in that case, the patient will actually see double from one eye only. There is uniocular diplopia and binocular diplopia. So uniocular means that the patient has double vision only in one eye. If I close my right eye, I can see double with the left. If I close my left, I can see double with the right. But something known as binocular is only when both my eyes are open, I can see double. So that usually happens in squints, but in cataracts, you can have a monocular diplopia, where in only one eye you have double vision. So such cases can be treated very well after cataract surgery. Once the cataract is removed and we put an artificial lens inside the eye, you get very good vision and the diplopia disappears. So very important to know what is the cause of diplopia. Only then can your ophthalmologist prescribe or tell you how to manage it.
Follow Planet LASIK and post your queries to get answers from the experts.